Hi, my name is Hannah Holbrin, and I will be showing you how to properly bandage a wound. I don't have anybody to assist me, so I will be demonstrating on my foot. So first, before you do anything, you want to make sure the scene is safe where you see a victim, and double check that there's nothing dangerous that could happen to harm you, because you can't help them if you're hurt. After you have assessed the situation and realize what is going on, if you do, you want to put on gloves because you want to prevent the spread of infection. And by putting on gloves, you're not directly touching an open wound, and you're not only protecting yourself, but you're protecting that person that is hurt. So you would apply gloves, and you wouldn't touch your hair, but my head itches. You would apply your gloves, and then you would get closer to the wound and assess what has happened. So let's, for example, I'm going to use my foot, but I don't want to show my foot. Let's say that there's a cut and you realize that it is bleeding. You don't want to directly put a bandage on a wound because it's not going to do anything. You want extra padding. So what you do first is you're going to put a sterile dressing over the wound site. So we're going to place it on my foot, and you want to, if you can, get a sterile dressing that's large enough to go over, because you don't want it to not be big enough. Afterwards, you hold it down, and then you take your bandage, and for this instance, we're going to, I didn't wrap that right. We're going to wrap it around my foot about 2 or 3 times to hold it and anchor it in place. When you are bandaging a wound, you don't want to put the bandage too tight, because then it could possibly lead to blood clotting and cutting off circulation. So you want to wrap it around the foot a couple times. Then you want to come up behind the ankle and wrap it around the ankle just as extra support. And then you're going to begin doing a figure 8. And this just properly finalizes the support in the ankle, and that the sterile dressing isn't going anywhere. You can barely even see the sterile dressing anymore. And then you tape it down, and while you're doing this, which is me, you want to ask your victim, are you okay? Is this too tight? Is this too loose? You want to make sure that it's comfortable for them, but you don't want it to be too tight or too loose, like I said, because you don't want it to fall off, and then you don't want to possibly cut off their circulation or cause further problems. So after you have finished bandaging up their wound, you want to dispose of all your contaminated, nasty products. You may have blood on these or whatever it may be. So we're going to use a proper glove removal technique where you pinch on the inside and you pull up where the clean inside part comes out. Then you're going to wrap it inside your dirty glove. Put 2 fingers in here, keeping the dirty off of you, and wrap it up. And now the clean is inside the dirty. Then what you do, which I forgot to grab because I'm unprepared, but what you would do is you would take this, and the ideal situation is that you would put this in a biohazard bag if you had one, or a Ziploc bag. That would be ideal. Or if you don't have those at hand, a Walmart bag would work, and then you can properly throw that in the trash, because you don't want to get the blood or fluids or germs transferred to anybody else. So that's just an extra precaution to make sure that there's no spread of disease. And that is how you properly bandage a wound and make sure that no germs are spread.